Hello, everyone, and welcome back to People Do Wanna Know podcast. I'm bringing you a really unique episode today. It's the first of its kind, featuring Estie Rose and Shari Ungerleider from an organization called JScreen. JScreen is a national nonprofit Jewish genetic disease screening program whose mission it is to ensure that every adult in the United States has access to preventative genetic testing and counseling to inform their reproductive options and understanding of their hereditary cancer risks. While JScreen will service any person, they specialize in testing and counseling for Jewish families especially. I decided to do this episode after I got a lot of requests from listeners for an episode about Jewish genetic diseases. And let me tell you, it turned out incredibly insightful. I want to share a little bit about both Estie and Shari, who offer different dimensions to the episode. Estie Rose is a genetic counselor at JScreen. She graduated from Yeshiva University's Stern College for Women and then went on to complete her master's in genetic counseling from the Icahn School of Medicine at Mount Sinai. She has a special interest in community education and outreach and is proud to be a resource for individuals of her own community who are facing genetic health issues. Shari Ungerleider is the Education and Outreach Manager for JScreen. In this role, Shari reaches out to educational institutions, religious organizations, and advocacy programs to make them aware of JScreen's various offerings. She'll present programs and share her story to show the impact that genetic testing and counseling can have on family planning. Shari, along with her husband Jeff and father Stanley, founded the Evan Lee Ungerleider Foundation when her son was diagnosed with Tay-Sachs disease. This foundation is part of the National Tay-Sachs and Allied Diseases Association, where she is the past president and served on the board for over 20 years. Shari has 4 children, Evan, mentioned previously, Justin, Lee, and Sydney. In the episode, Shari will talk about her experience raising Evan and how she became an advocate to educate and raise awareness about the importance of carrier screening coupled with genetic counseling. She's been doing this advocacy work for over 25 years. Shari turned her family's tragedy into something positive so that others would be spared the suffering. I mean, you will hear it in the episode, but even to this day, I could tell that it's difficult for Shari to talk about Evan. She had her notes up when speaking about him. I can't even imagine what it must be like to have to retell that story. To channel your pain into something so amazing is incredibly commendable, and I very much admire Shari's resilience. Today, we'll learn all about Jewish genetic conditions, how couples who are carriers for these genetic conditions can safely have kids, and get a taste for the kind of work JScreen does. If I learned one thing from this episode, it's the vital importance of genetic testing. Whether you're a woman, man, single, married, planning to have kids or not, the learnings from this episode are valuable and important, and I'm glad I got a chance to share them with you. Please enjoy this episode. Estie, Shari, welcome to People Do Wanna Know podcast. How are you today?
Thanks for having us.
Great. Thank you so much for having us.
What a privilege. I'm super excited to chat with you today and also learn a little bit more about Jewish genetic diseases. So my first question for you is, tell us about yourselves. What do you do and how did you get there?
I guess I'll start. My name is Estie Rose and I am a genetic counselor at JScreen. I have been a genetic counselor for over 15 years, and a very big part of my love of what I do is because I get to service my own community. So I went to genetic counseling school because I've been interested in genetic diseases for quite a long time, since I was in college. And I wanted to find a way to incorporate my interest in genetic diseases and genetic counseling with my own people in my own community. So unfortunately, the Jewish community has a lot of Jewish genetic health issues. And with my expertise as a genetic counselor, I can help my fellow community members navigate those issues. I've been working with this community for most of my career, and I'm very proud of the fact that I'm able to do that.
And my name is Shari Ungerleider, and I am one of the outreach and education managers at JScreen. And I think it's important to know my story to understand why JScreen and the work I do here is so important to me. So in August of 1994, my first child, Evan, was born. We had the joys of watching him develop normally for the first 6 months of his life, and we also had the normal hopes and dreams for his future. During the next few months, we started to become concerned as Evan wasn't developing at the same pace as other children his age. We witnessed his friends begin to crawl, sit up, stand, walk, and interact with each other. But Evan wasn't able to do any of that. He couldn't stand or even sit by himself. He started to become irritable and wanted to be held all the time. And he also began having trouble swallowing, which made mealtime stressful for both he and us. Then when he was 10 months old, we took him to the pediatrician for what we thought was a standard well visit, but this really turned out to be the beginning of our nightmare. Our pediatrician was concerned with the lack of Evan's development in almost all areas, and she recommended that we go see a pediatric neurologist, which we did. We spent the next 3 months visiting numerous doctors and having Evan undergo numerous and endless invasive testing. All the while, we were trying to comprehend what could be possibly wrong with him as he began to progressively worsen. In the meantime, I took Evan to see a pediatric ophthalmologist who discovered a cherry red spot on his retina. Hearing this news was like having a dagger stabbed through our hearts because I knew it was an almost certain indicator that Evan had Tay-Sachs disease from the research that I had been doing over the past several months. I contacted my OBGYN, who re-examined my record and discovered that I had actually tested positive as a Tay-Sachs carrier. So now a series of errors occurred as my results were transferred from one lab to another and then on to my doctor, which created the perfect storm and resulted in me not knowing that I was a carrier. I called Evan's neurologist, who said, "I think we just found the missing piece of the puzzle we've been searching for." A few days later, after further testing, Evan was diagnosed with Tay-Sachs disease. Our lives had now changed forever. We quickly researched the likely progression of Tay-Sachs disease and had to deal with the fact that even with the best of care, Evan would likely not live to reach the age of 5. We met with the surgeon and had a feeding tube inserted so that he could stay properly medicated and nourished. Due to Evan's inability to move on his own, he had to undergo several hours a week of physical therapy so that his muscles wouldn't atrophy, and occupational therapy to manage the decline in his quality of life. He eventually became blind and deaf. He developed seizures and would have several dozen a day. He also had respiratory issues, which required us to provide chest physical therapy and to suction him regularly. Due to the certainty of an early death, but the uncertainty of the exact timing, we wanted to make sure that we didn't take a single moment of his life for granted. We knew that we wanted to care for him at home, but that we had to exercise extreme caution so that he wouldn't be exposed to germs that would cause unnecessary illness. A simple cold would turn into pneumonia and require IV antibiotics and a possible hospital admission. Evan lived until he was almost 4.5 years old. His disease impacted our entire family as he required care 24 hours a day, 7 days a week. Luckily, we had an amazing support system to help with his care. Some of my best memories from when Evan was alive are the times that we would go to the beach, the park, or the pool. But instead of packing picnic lunches and toys, we were dragging around the necessary medical equipment that he needed throughout the day. Although my husband and I knew that Evan's disease was terminal, we were completely shocked the day he died because there is no way to prepare yourself for the death of a child.
Shari, was this your first child? Was Evan your first child?
Yes, he was.
That's a very difficult experience. Tell me, how did you find JScreen and how did you decide to work there?
So I've been working in the field of, genetic disease education really since Evan's diagnosis. It was just so important to me that I thought I was being responsible by relying on my doctor to do the right testing and interpret the results correctly. And I was never told that there was a genetic counselor or even that there were other diseases to be tested for. So really from very early on, I was very passionate about making sure that other couples understood the right way to do genetic testing. And then when JScreen was founded almost 12 years ago, I started working with them. And then, officially 5 years ago, came on staff with JScreen and just have been working with them on reaching out to communities and making sure that everybody understands what test JScreen has to offer.
Tell me a little bit about how many families this impacts or how many families you service that end up finding out that they might be a carrier, right? Because this is something that is preventable if two people know that together they might have a child with a certain genetic condition. And even if they do have a child, sometimes the child is not going to have the condition, but the odds are just much higher when you have two carriers. So tell me a little bit about how frequent is this in the Jewish community and how many families does it affect?
So it depends what people's backgrounds are. So people who are of Eastern European or Ashkenazi Jewish descent are just more likely to be carriers of Tay-Sachs and a number of other genetic diseases. The more diseases that you're testing for, the more carriers you're going to find. So now that we're testing for over 250 diseases, I would say most people, a majority of the people that we test, especially those people who have some kind of Ashkenazi background are going to be carriers for 1, 2, even 3 or 4 things. This is a very big part of our counseling, is that this is a normal thing. Like, we're going to try to normalize being a carrier because most people are carriers, and most people that we test are going to need counseling about what the diseases that they're positive for mean and what they can do with this information. Now, even though most people are carriers, the likelihood of finding a carrier couple where both partners are carriers for the same condition and would have that higher than average risk for a child to be affected, the likelihood of that happening is not high. So yes, most people that we're testing are carriers, but they're not part of a carrier couple or a high-risk couple. Depending on how common a disease is, you're going to see carrier couples more or less often. Tay-Sachs, for example, 1 in 30 Ashkenazi Jews is a carrier for it. We see carriers all the time, but the likelihood of them finding each other is not that high. And what happens when we do find carrier couples, that's what I do. I talk to them about what it means for them, what options they have. We go through all the different reproductive options, like I'm sure Shari will talk about her own experience, but having this long conversation with a genetic counselor is something that Shari didn't get. And that's a very, very big part about why we exist is we're not just doing the testing, we're doing the counseling with it. And we're giving and empowering people with different options and helping them do what makes the most sense for them.
So I just want to add that, my husband and I did go on to have 3 other healthy children. With each of my other pregnancies, we did update our screening for diseases that were added to the panel in between each of our subsequent pregnancies. And now knowing that we were both carriers of Tay-Sachs, it enabled us to choose the right path for us, which was we chose to get pregnant naturally. And I had a CVS test performed with each of my other pregnancies to determine if that pregnancy was affected with Tay-Sachs disease. I did have 2 other pregnancies, one that I lost to a miscarriage and another one that was affected, which we decided to terminate. So, again, knowing this information just allows you as a couple to decide what the right option is, to go on and to build your family.
And when Shari was having her kids, it wasn't as common to use assisted reproductive technologies as it is nowadays. I don't even know if you were counseled about that, Shari, but nowadays,
it was really brand new. And I mean, even CVS testing was, there was only 2 places in the country to do it. So
yeah, we've come a really long way. So nowadays we talk to our high-risk couples about those options that Shari and her husband use. But another option that we talk about is using assisted reproductive technologies to avoid getting pregnant in the first place with a baby that's going to be affected with one of these conditions. So in some cases, that could mean using a donor, either an egg or a sperm, who's not a carrier, who is tested and is not a carrier for that condition. And in other cases, that might mean using the parent's egg and sperm and creating an embryo outside of the body in the lab through in vitro fertilization or IVF. After that embryo is created, they can actually do genetic testing on the embryo to see whether or not it's affected with said condition. They don't test for every single genetic disease, only the 1 or 2 that we're really concerned about. It's only an 8-cell embryo at that point, so you don't have that much DNA to work with. And if they see that an embryo is affected with a condition, they'll discard it in the lab. It will never become a pregnancy, which is, an incredible, amazing opportunity that we can give to our high-risk couples nowadays that it wasn't available back in those days. I'm sure a lot of your listeners have heard of IVF. They might know what IVF is. I don't mean to just say, just do IVF. It's not that simple. IVF comes with a lot. It's not easy physically, emotionally, financially in many cases. It's not a walk in the park, but at the same time, it's an unbelievable option that we're able to give our carrier couples nowadays.
I'll also just add that in the same vein, IVF is kind of similar to egg freezing, where, many women think, I can just freeze my eggs, but doing that kind of process and injecting hormones into your body is taxing on the body. We're not meant to have this huge spike of hormones as women in our bodies. And for example, I know from personal experience that if you have a predisposition to cancers, for example, in your family, IVF comes with a risk because ingesting additional hormones can catalyze or expedite malformed cell production or whatever you want to call it. And it could increase your risk of cancer, actually. It's a decision that has to be weighed correctly. The natural question that comes to mind is you two are both observant Jewish women and you work for a business, JScreen, designed to service Jewish people, many of whom I assume also are observant. And so reproductive health things like terminating pregnancies, things like IVF, they often come with a whole suite of ethical dilemmas, according to Judaism. Talk me through how you think about these different situations and how you help couples make the right decision for themselves.
This whole reproductive world and the world of ethics and medicine is, I think there's a lot of misconceptions from the outside Orthodox community in this world. So I think that people think that the Orthodox community is very strict and very conservative and they won't allow anything and everything is by the book and to the letter of the law. But I see the opposite, actually. When it comes to health-related issues, there is a lot of leeway because the biggest mitzvah, the biggest thing that we can do for ourselves is to preserve our own health. So there are many, many, many instances where people might be surprised to learn that rabbis are more lenient in many cases. So for example, let's talk about termination. I know you had brought that up, Margarita. There are many, many different times when a rabbi might allow for a couple to have a termination of a pregnancy. For example, if a baby is affected with a lethal disease like Tay-Sachs and they find out during the pregnancy, if the baby doesn't have a brain, if the development is not normal, there are cases like that where it's incompatible with life or will lead to an early death. There are many rabbis, I would say most rabbis would allow for a termination in cases like that. Especially, also another example would be when a pregnancy might compromise the health of a mother. So if, the mother is having an obstetric complication and it could be very, very dangerous for her. In certain cases, they need to end the pregnancy for the mother's health. Those are just two very fast examples, but there are many, many other ones where with the proper counseling and the proper discussion about what is going on in this one specific case, there's many leniencies. A big part of our counseling is having this conversation with people and giving them every single fact that they can have. And either they can make their own decisions with those facts, and sometimes they need to bring it to a third party, like a rabbi, for example, to help them make either, a halachic judgment or, ethical judgment or whatever it is. Sometimes they do it themselves. Sometimes they involve the rabbi. Sometimes I get involved in the conversation with the rabbi. So it's not a black and white thing. There's a lot of gray area here. And I like to empower my patients with all the information that they can use to make a really big decision like that. That's a very big tenet of genetic counseling. We learn about non-directiveness when we're in grad school, that we're not there to tell a patient, I think you should do this, I recommend that. Actually, what we're there to do is to just give the information in as an objective a way as possible and just empower them with information so that they can do with it what they need.
Yeah, and I just want to add to that having experienced it both ways, going through genetic testing without counseling and later finding out that my son was actually diagnosed with the disease that we were screened for. And then with my other pregnancies, not only updating my carrier screening, but talking to a genetic counselor, understanding what my options were and, just providing that information to my husband and myself. They're never easy decisions. It's just what's best for you and your husband and the rest of your family at that time. And speaking to someone who's trained both in the science of knowing what to order and how to interpret it, and someone who, that same person who can counsel you and be compassionate and help you understand that. I mean, there's no comparison there. Genetic testing, I strongly feel, should not be done without genetic counseling.
I was curious to know if there's anything that you counsel on regarding autism, because it's not something that you can really test for at all. And my understanding is, from a scientific standpoint, there hasn't been a way to predict that a child is going to be born with autism. Is that right?
Yeah, it's a complicated one. We get that question all the time. Most cases of autism are not purely genetic, meaning one gene causes it, like Tay-Sachs, for example. Most cases are understood to be multifactorial, which means that there are different components that when you put them all together, that might make a child have autism. So it could be a genetic factor. It could be a number of genetic factors. It can be environmental factors. It could be a virus that the mom had when she was pregnant. It could be a host of a lot of different things that when you combine them together, that leads to a diagnosis of autism. So unfortunately, there's no one genetic test that you can do to predict whether or not a child will have autism. I will add that there are a lot of genetic syndromes where autism or autistic-like behavior could be symptoms of a larger syndrome. And those syndromes you could test for. So it's very common when a pediatrician sends a family to meet with a pediatric geneticist to do some kind of genetic testing when they think there might be something going on with the child, to say, okay, well, we'll just run the test and see maybe this is part of a bigger syndrome. But it doesn't always come back positive, and they're not always able to come up with a cause or a genetic cause for that autism in the child.
Got it. Thanks. This is very helpful. I want to pivot a little to talk about JScreen. Tell me a little bit about the company.
So JScreen is a national nonprofit, and we provide education and access to genetic testing. So we offer both access to reproductive carrier screening and hereditary cancer testing. So what we're doing, like in my role, I'm going out and I am educating the community, and that could be the lay Jewish community or the rabbinic community or physicians, about the importance of everybody being tested for reproductive carrier screening before they start or add to their family, and also the importance of people understanding what their risks are to develop certain cancers with the hereditary cancer testing. And JScreen is innovative because we are medical grade testing with telehealth genetic counseling. So meaning that if you are interested in registering for one of our tests, you go online, you register. Our genetic counselors review the information on the back end, and then a third-party physician ordering service orders a test, and then our lab partner, sends a test to you. You spit in the tube, you send it back, and then when your results are ready, you get an email with your results and a button to click on to do genetic counseling. So Estie, I'll let you then talk a little bit more about the exact tests that we're doing.
Yeah, so in terms of the actual testing that we're doing, I would say that we're just a product of the history of genetic testing. So back in the day, in the early days of genetic testing, we only knew how to screen people for Tay-Sachs disease. That started actually pretty early on in the 1970s. At the time, we didn't know anything about genetics, but we did know that babies who had Tay-Sachs were missing a certain enzyme, and that their parents had a certain number or volume of that enzyme in their blood. So what these medical professionals would do is they would get in a van, like a little trailer, and they would drive through different Jewish communities, mostly in the Northeast, and I think in California as well. And they would go to synagogues and temples and GCCs, and they would just screen people and see how much of this enzyme they had. And if they saw that a couple had that amount of enzyme that would make them a carrier, which is, I don't know if that's the term they used in those days, but whatever. If they saw that they had that amount of enzyme, they would just recommend that they don't get married or that they don't have kids, because at that time there was no IVF, right? They weren't doing CVSs where they were, using ultrasounds and looking for the baby. They just didn't have those technologies. So in order to kind of circumvent that 25% risk for carrier couples, they would just advise them not to get married. We've come a really long way since then. Now we have discovered the genetic basis of many, many diseases. So it's not just Tay-Sachs. At JScreen, for example, we're currently testing for 265 diseases. So we've come a very, very long way. And we're not doing a blood test anymore. We're doing a spit test, as Shari said. And we're able to test people for a very, very wide range of diseases. So wide range in many different aspects. So one way is how common they are. We're testing for things as common as Tay-Sachs and Gaucher disease, another very common Jewish disease, cystic fibrosis, and things that are less common. Let's say 1 in 200 or 1 in 300 Ashkenazi Jews are carrying. Another new thing is that we're testing for diseases that can affect anybody. So it's not that we're doing testing only for people who tell us that they're Ashkenazi Jewish. Now we're testing for people who are fully Ashkenazi, who are partially Ashkenazi, who are fully or partially Sephardic or Mizrahi, or people who don't have any Jewish genetic ancestry at all. Maybe there were converts in the family. And also we're testing for people who don't identify as Jewish either. We're just testing everybody for everything, because anybody could be a carrier. So I think there's a misconception about that only people who are Ashkenazi need to be tested. That is absolutely not true. People who are Ashkenazi are at a higher risk to be a carrier. So it's more likely that they'll be carriers, but it's not exclusive to people who are Ashkenazi. So anybody planning to have a child, regardless of their ancestry, should do a very thorough and comprehensive genetic test. anytime they're planning for a pregnancy. So whether that's their first pregnancy, whether they're getting pregnant in not the natural way, whether they're using donors or not using donors, whether they're Jewish or not, whether they already have 2 kids and they're trying for their 3rd kid, it doesn't make a difference. Anytime anybody is planning for a pregnancy, they should make sure that their testing is up to date. So in addition to the reproductive carrier screening that we do, the Tay-Sachs and cystic fibrosis testing, we also have a different test called our hereditary cancer test, where we screen people to see if they have mutations in cancer genes that would predispose them to getting cancer. This would be good information for people, especially those who have a family history or a personal history of cancer, because if they learn that there is a genetic reason for those cancers and they are at increased risk, many times there's something that they can do to get ahead of that risk, to either catch it at an early and treatable stage or to even prevent it from happening in some cases. And we're testing for 48 different cancer genes now. Breast cancer genes, colon cancer, pancreatic cancer, prostate cancer, you name it, there is a genetic test for it. So this test is appropriate for anybody, men and women, who might be interested in knowing their cancer risks.
And tell me, what kind of price point are we talking about on these types of tests?
So to be a JScreen patient, we do charge an upfront fee of $49. And then after that, for the testing, JScreen doesn't get involved in that, but the lab bills insurance for testing. Depending on people's plans and their deductibles, it's always going to be a different number. Every single patient will have a cost estimate emailed to them before the results are released, where they'll basically find out what it's going to cost them. And if they are not comfortable with that number, they do have the option to switch to the self-pay price, which is $249. So the max that it would be in most cases would be that $49 upfront fee plus a max of $249 for the actual lab work.
Thanks. I'll just mention here before we move on, I'm the insurance finesse queen. Let me tell you why. So there are often instances, everybody should know this listening to the podcast, that you are better off self-paying for labs or other procedures than you are if you have insurance. You pay for insurance, and then when the insurance bills you the remainder after what they've covered, it's sometimes still higher than if you just self-paid. So the pro tip here is to always find out what the self-pay price is and compare it to what insurance gives you as an estimate. Because I've gotten burned so many times working with LabCorp where their prices are always better when you self-pay, like much, much lower. They explain it as that there are no administrative costs or administrative overhead when you do self-pay. And when they take the time to receive the money from insurance, it takes longer. They have administrative overhead they have to cover. So they raise the price. So to those listening, always ask about self-pay. Insurance is the bane of my existence. I also refuse to pay. I also often, I might put this in this podcast, honestly. I often refuse to pay medical bills unless they give me a discount. And believe it or not, they always give a discount.
I know, just ask.
Well, that was right. And that's important to understand also is that, listen, the lab is going to bill to insurance, but we never want, cost to be a barrier. So if someone gets a cost estimate that's above the $249, but they can't even afford the $249, like there are options, and we want people to contact us so that we can help make it as affordable as possible for them.
Okay, amazing. Moving on. I wonder, are there any emerging discoveries on the horizon that could impact Jewish couples in the future, be it genetic related or otherwise?
There's been a lot of talk about a technology called CRISPR. You might have seen it on the news, where they're trying to basically edit genes. So change them so that when there's a mutation, they can literally cut that mutation out and replace it with a normal copy of the gene. They've been talking about this for a long time, so I don't think we're quite there yet. We're getting closer. We're definitely getting closer. And I think that once this technology becomes more reliable, it will change the future of genetic diseases. I was actually recently at a conference, and there was an OBGYN there. So he does surgery. He does fetal surgery. So he does surgeries on pregnant women on the fetus during the pregnancy. So it's the most incredible, amazing thing ever. And he was talking about doing CRISPR on fetuses. So it's not that far off in the future. I think it's going to happen. He's done it himself. So it's going to be more common. We're getting there, and it's going to be amazing.
That honestly kind of sounds terrifying. I'm not going to lie.
It felt like a sci-fi movie when we were listening to it, but you should have seen the audience. Like everybody was like wow, I can't believe this is true. He was showing us videos of it, which was really graphic, but it was also incredible. Like he's saving babies' lives before they're even born. So we're getting there.
As genetic science advances, there's also research into treatments for some of these diseases. Again, we're not there yet, but hopefully in the near future, some of these devastating diseases where there is no treatment or a cure, there will be soon.
Yeah, it does exist for some of the diseases that we're testing for. There are gene therapies for, like, SMA is one of the very common diseases that we're testing for. There's another type of therapy for cystic fibrosis, another very common disease both of these are pan-ethnic, which means that they're common in people of all backgrounds. So we're getting there disease by disease, and I'm very hopeful for the future.
Is the reason that the Jewish community in particular, I know there are other minority groups that have their own conditions and diseases, like when you take sickle cell as an example, right? But there are so many conditions within specifically the Ashkenazi Jewish community that are difficult and terminal, like you would say. Like, what is the reason that Ashkenazi Jewish people have such a high risk of getting some genetic mutation?
So a lot of it has to actually do with Jewish history. So now I'll take off my genetic counselor hat and I'll become a historian. It's called the founder effect. So basically, let's use Tay-Sachs as an example, and let's use a small community in Poland in 1941. Okay, so in this small community, let's say there are 100 people and one of them is a Tay-Sachs carrier. Not that common, 1% of that population is a Tay-Sachs carrier. We all know Jewish history happened, and there are many examples of times in Jewish history where Jewish communities shrunk for whatever reason, whether it's the Holocaust or the Crusades or, any pogrom, you name it, and the size of that community shrunk. So let's say that community of 100 now becomes a community of 10 people. And let's say one of those 10 people that survived is that Tay-Sachs carrier, right? So now that Tay-Sachs carrier is no longer 1 in 100, he's 1 in 10, right? So he moved from a 1% to a 10%. We also know that in Jewish history, when those type of events occurred, the Jewish community has rebounded and very quickly expands itself. And let's say those 10 people that survive that event go on to have children. So that one guy who was now that 10% has more children, and then all those children have a chance of being Tay-Sachs carriers. So because of Jewish history and people with mutations surviving historical events and reproducing, these things have just become more common. And in addition to that, it's not as common nowadays as it used to be, but intramarriage, right, where people are marrying within their own community. So Tay-Sachs carriers that are commonly seen are going to marry Tay-Sachs carriers because we marry each other. That's why I always like it when I have couples who are mixed, right? So I have an Ashkenazi guy and a Sephardic girl. I love that because we're kind of mixing things up a little bit.
Tell me, is there any stigma in the community, in the more observant community, about getting this type of help? I ask because, one, it's my own ignorance, but more so, I know that there's stigma within the observant community about the inability to have children. It's always a big sadness for especially observant families who aspire to have many children, right? In Judaism, it's beautiful when you can have many, many children, and God willing, all healthy. So is there any stigma around genetic counseling, and how are you helping these families understand? Because in some sense, they have to come through your door first, right? You know that you're getting couples that are already on board and understand the importance of genetic counseling. Are you ever doing outreach to try to help couples understand that this is very important and should not be stigmatized?
Yeah, I mean, we absolutely are doing outreach in all different Jewish communities to help people understand that there is no stigma in being a carrier, and that even carrier couples have halakhically acceptable options to build a family. Are there communities that don't believe in the type of screening we're doing? Absolutely. But again, we're just out there to provide the information. What we offer, we consider to be open testing, meaning that we're screening an individual or a couple and sharing that information with them so they know what they're carriers of. And even if they're not a carrier couple, it's important to share their individual carrier status with family members, as opposed to, closed type of testing where you're doing the testing, but the results aren't being shared with you.
Now, as we wrap here, My audience is predominantly young Jewish professionals in urban cities, and I think most of them would aspire to have kids. Is there any message that you want to leave with them as they're thinking about starting their own families?
Yes, call me and we can come set up a program in your community. We can educate you and your friends or your work colleagues. We can educate your synagogue. We can do programs. We could do on-site screenings where we'll come into the community and, we'll do the screenings there for you. Yeah, but just reach out to us and we can help you to find out how to go about getting screened.
Tell me, how can people connect with you on social media or otherwise and learn more about your work?
Yeah, so you can find us online. Our website is JScreen.org. And if you're on social media, Facebook or Instagram, just look up JScreen.
Excellent. And I have one final question for you. It's one that I ask all my guests on the podcast. Who would you like to nominate for People Drew Want to Know?
Yeah, so Shari and I were discussing this before, and we both said the same person at the same time. So it has to be her. I don't know if you know Gila Pfeffer. She is an author and a humorist and a patient advocate for BRCA testing and cancer prevention. She is wonderful. You can find her on Instagram. Just her handle is at Gila Pfeffer, and she would be an amazing, amazing guest on People Do Want to Know.
Excellent. Thank you so much. This has been a tremendous conversation. If you've enjoyed this podcast, please go ahead and rate us 5 stars. Be the first to hear our episodes by subscribing to People Do Want to Know wherever you get your podcasts. And for exclusive content, follow us on Instagram at People Do Want to Know.